I have nothing to disclose. Good afternoon, ladies and gentlemen. I'm Pingrui Li from Taiwan. I represent my colleague to share this topic: transurethral incision of bladder neck in women with Detrusor underactivity. This is a 10 years of retrospective chart review in female patients with DU and received TUIBN at our hospital. Our study is to investigate the effect and quality of life improvement after TUIBN. We use IPSS quality of life and GRA as subjective endpoint and urodynamic parameters as objective endpoint. A total of 82 female patients was enrolled. The mean age was 61 years old. Half of them presented with a contractile bladder. TUIBN was performed under general anesthesia. 2 incisions was made at 5 and 7 o'clock position of bladder neck when the bladder was fully extended. The incision was deepened gradually to the level of the bladder base, and the smooth muscle of bladder neck was completely interrupted. As picture E shows, the bladder neck was widely open after the incision. When compare the urodynamic parameters before and after the surgery, TUIBN significantly increased maximum flow rate, voided volume, voided efficiency, and decreased post-void residual. Mean GRA scales was 1.4, and the IPSS quality of life significantly improved as well. As shown in this table, about 61% of patients were able to void after TUIBN, and the long-term enduring calciter decreased from 23% to 6%. Overall, 32% require additional procedure, including repeat TUIBN and urethral Botox injection. 72% of patients were observed to achieve satisfactory outcome during follow-up. However, some of them faced with urinary incontinence after TUIBN led 12 patients were treated with conservative treatment, and 5 patients were treated with suburethral sling procedure. In addition, 2 patients developed vesical vaginal fistula after repeated TUIBN. So in conclusion, TUIBN is an effective procedure to improve voiding dysfunction in female with DU with acceptable complications. More than half of the patients benefit from this simple procedure and had satisfactory outcome. Thank you for listening.
So any question? Kari, you had a question.
Yeah, thank you. Thanks very much. This is obviously thought-provoking and like people are thinking, okay, like is it, my question is, are you, first of all, I hope you're planning a controlled study on this. I mean, because we really don't know yet whether this works with this first report but because the question is, what kind of patients did you actually have? So did they still have some kind of obstruction or some kind of stricture or some kind of what you actually were treating by just bringing the scope inside of the bladder, or and are you planning a control study? And if you are, because I think you could do a control study, and I didn't see, and there's a little bit too many questions now, I know, but did you do the TUIP? Did you do like 1 or 2 or 3 incisions?
2 incisions at 5 and 7 o'clock.
Like the very traditional?
Yes.
Okay. So, and what kind of patients did you find? Because I think you must have hundreds of thousands of patients with this problem, but then suddenly you chose 80 who you retrospectively then looked. So how did you choose these patients for this procedure?
Okay. Mostly, this patient has experienced urinary retention for years and with large PVR, and they must undergone VUDS before the procedure, as the diagnosis of the Detrusor underactivity. So, however, some people were included because of pelvic organ prolapse, severe illness, ECOG status, or previously received lower urinary tract surgery, so which related to only 82%.
Yeah,
Okay.
I would really like to see a sham control study on this. This would be very interesting, and it's pretty easy to do a sham control with this relatively easy procedure technically.
Okay,
Thank you very much.
But there's
Thank you
one
very much.
problem. He mentioned it's a safe procedure, but I disagree because you have at least 20% of incontinent women, and you even have fistula.
Yeah.
So in Germany, when you would like to do a study, the ethics committee will not allow this. I can tell you, it may be possible in your country, but it will be very impossible in Germany. I can tell you.
Okay, thank you.
I had a couple of points. What was wrong with the 12-year-old that you did this in a 12-year-old? So your age range was 12 to 102. 102 doesn't sound great either,
yes.
but the 12-year-old, what was their underlying diagnosis?
She's a victim of the spinal cord injury patient.
Right, okay. And then my other question was, you also mentioned these are all treatment refractory for DU, but you treated them with antimuscarinics and beta-3 agonists, which is not a treatment for Detrusor underactivity, it's a treatment for Detrusor overactivity. So was there any other types of treatments that you'd considered in those patients?
Do you mean the other options for these patients?
Yeah, so Detrusor underactivity isn't treated with antimuscarinics or beta-3 agonists. That's for Detrusor overactivity. And the final thing was just with regards to the quality of life measure you use. So you use the IPSS, yes. But obviously that's validated for men rather than for females, so you probably need to pick a different quality score as well.
Okay, I know. Thank you.
So thank you very much. We have to continue. Thank you very much.